Right, so now come to the part two for today's discussion, it's addressing client unrealistic expectation. Sometimes client really believe that we have like magic wand,
Yeah.
ting ting, your problem solved.
We don't ask magic questions in session.
Yes, one of our technique.
Yeah.
No, I'll be honest, we don't have magic. That's so powerful, can just bring all your issue gone.
Mm.
Okay, we're going to talk about in addressing this aspect as well, because I think that will help you also to count understanding what to expect in therapy session. So we're going to talk about our encounter and sharing with you. Okay, let me start with you first.
Okay.
Let one rest.
Yeah.
first.
Okay.
Yes.
Yeah, so I guess with unrealistic expectations, I would say that for us therapists, it sounds like unrealistic expectations, but for the clients, it might be during there and then, right? There is this immediacy, right? Which is to maybe fix a situation, to get out of a difficult point in life. So in this case, it becomes a very stressful situation for the therapist because we can feel the client's struggle at that moment, right? And then at the same time, we know that we can only do so much in that 1 hour, right? So in this case, I would say the unrealistic expectations that came forward usually, it is in my experience, right? It's usually the immediacy of addressing a situation, or the problem is put on the table and they're like, okay, we have this thing, we need to fix it, and you're here to help us deal with it. Yeah, I'm wondering if that's what you guys go through as well.
How about you? So when you came across that experience feeling, give me an answer now. Kind of literally asking the doctor, give me medicine now.
Yes, something
Yeah.
very similar. But for the kind of issues, right, that they bring up, maybe like things that I really cannot manage, like issue with boss, or like money, or like mom is not is pressuring too much. But these are the things that they are not in therapy, right? I can't really change much of that. And so like there are times like this where I really wish I have magic words. I really wish that I'm a genie in a bottle. I can say the right thing and poof, all those kind of issues are solved. So because of this, right, I'm actually quite envious of certain profession and consultants, because they are not bound by our own ethical codes. They are not bound by our own theory and practice, and they can freely give advice. They can freely give direction to clients to do this, and definitely you will reach your goal. And I'm very envious of that, because I wish I can do that, but I know that doesn't help the client at all, because it will just make client reliant on them keep giving advices and then keep giving direction. So there's also another challenge that I face, is that maybe like you said, they come in, they want a solution immediately, right? But us, naturally, we don't give out solutions. Instead, we try to empower them to find the solutions for themselves. But in that case, right, client not getting what they want, would they come back?
On that one you share, I feel like it's a goodness of fit for the client as well. So some clients I guess some individuals, when they are not so stuck, right, consultants can give them a little bit of pointers for them to go and continue on. So it's like depending on the spectrum of the needs they have. And I guess as a therapist on the other side, usually the cases where we get is the client is struggling more emotionally. So there's no right or wrong answer. So for example, like what you say, right, if it's a career, then the career consultant will be like, okay, this is how you progress in terms of your career, and this is what you do. So so with a therapist role, it's really rather different. Right, so this is a good platform to address that as well, in terms of how we approach things. Is like, if you ask us for answers, right, the answer is, well, it depends on how you see it yourself.
Actually, we can be putting a very difficult spot, I would say, because sometimes we acknowledging that when you come for therapy session, because consultation is not cheap. We understand that. So you wanted to be able to maximizing an hour, or even sometimes 1.5 hours, depend the natures of the session. Then you wanted to be able to fix whatever issue they have. But the tricky situation is we can't really just fix it without knowing what's going on in detail. as you mentioned that commonly you experience this issue maybe years, sometimes can be 5 years, 10 years. So I think it would be unfair for any therapist just, okay, you just do A, B, C, done, without considering the past 10 years struggle you have, and to kind of designing the intervention best suit whatever circumstances that you face. So I felt that is something that we also want to highlight. It's not so much into we do not want to give you a quick fix, but sometimes it's to honor you, to understand your background, to understand where you're coming from, and therefore we can have time to be able to work with you. But I do agree with Celeste. There's times that sometimes we do provide practical skill set to get you able to managing and ease these difficult situations. But it's important to be aware. If someone can just give you an answer, a quick fix, I can do it within one session. I will want you to really thinking through and checking out really these therapies, because I don't think any experienced therapist can say just quick fix within one session. Because I found that would be not honored, your background, your story, whatever that you're coming from. So I think that is also something that we hope to be able to clarify as well. Yeah, so I'm just curious how you're managing that. There's sometimes when this difficult moment comes. Celeste, tell me how to solve this. I need an answer now. Give me. So how are you managing this aspect?
That's a very interesting situation, because I don't think I have a client that's go straightforward like, now I need an answer. Yeah, but I do have quite a few that they are very anxious, right? They would want to hear a straight answer from that. There are some that say, tell me, should I or should I not go ahead with this decision? And I was like, okay, right, what we can do is we can break it down. I feel like what I can do is to, in opposite of what they want, is to slow them down. Which for me at least, right, it helps with processing it across. So for example, maybe it's not something very mental health related, right? But in this case, it does affect the client's experiences or their well-being once again in terms of what they're struggling. So what I can do is to sit down, break it down with them, especially going through the pros and cons with them. But sometimes back to basic is something we do as well. Just really sitting it down and going through, okay, what happens if you do this? And then if there are some assumptions that the client is making, then that's where we challenge them as well. Okay, is this an assumption or is this really what's happening? So that kind of guide the client through versus definitely go ahead with this, because I cannot choose. Because I wouldn't know the answer as well, actually.
Very true. Sometimes we do not have the answer. I think that is some of the quite common practice we do. Try to look into the pro and con, so therefore you make a better decision. But the pro and con are identified by you. So I say not just identified for you. So that helps the therapist to be able to discerning it with you. So therefore you can make a better decision. How about you, Wai? Came across that experience? Give me answer now. How I respond
Pressured
to
by
client.
boss. I think very similar. Going back to basics like CBT techniques, I guess. Comparing the pros and cons, writing down the list or like all the boxes, just to check out like whether making any kind of decision is it good or not for you. Because at least for me, again, I want to reiterate that the expert in life is still you. You are still the expert in your own life, and still believe that the resources you can still get it from your own self. I think from our responsibility is to help to bring out that awareness and that resources out from you. So we can't, unfortunately, still can't give the answer. Still can't give an answer to you.
It's actually true. Right. I would really like what you just shared as well in terms of the different resources, right? So therapists, there's a lot of different resources, different modalities, like what we were talking about in part 1 as well, right? To guide the client along, like you along in the session. So it depends, like let's just say if you were to use CBT, then we'll be identifying a lot of what doesn't work, right? So in terms of ACT, then you'll be looking at which value do you actually want first when they are making decisions. So we have tools to help, right? But we wouldn't be jumping into conclusion and say that this is definitely the best solution for this situation.
Unless that solution is really harming you or like it's very, very, very bad, then we will stop you. But usually we don't.
I think that's where we play that role as well. Kind of listening together with you. What is the choices you can make that minimizing hurt to yourself? or pain to the others and pain to you. I think
Mm.
that's where we also discern with you. For me, as I mentioned, I work with a lot of couples and family. Oh, I constantly will have this. You know, Nicole, this is my last straw coming for addressing this couples issue, my family issue. So it's like, that's it. The first session, we need to make changes. So I cannot deny it's very pressuring because sometimes you have family who are in crisis or couple in crisis. Yeah, but it's also important to acknowledge that I know that sometimes you may desperately need an answer immediately to be able to do something because you can come making a decision, moving on, or staying in this relationship. But I think my proposal for all of you, rather than so fast looking into fixing it quickly within one session, I would say that do wait until that extent. Sometimes relationship can solve, when there's a tension. Wanted to do something about it and start to seeking help. Because when come to a very, very difficult moment when you both already start fighting, screaming, and very challenging to face each other, that it take longer time to able to feel better, able to help and ease this tension. So I think the message here is also wanted to share is don't drag too long. Sometimes relationship issue can be so powerful affected us, not just in terms of us in the relationship, but sometimes it's also how we feel about ourselves. So sometimes take this proactive initiative, seek couple therapy, seek family therapy. We are more willing to support you to able to provide support needed to minimizing that negative implication.
I think that's interesting because we talk about unrealistic expectations in the direction of when the client is very immediately seeking solution. But we definitely have some clients who are on the other side, they minimize the situation as well. So sometimes they are asked to join in session, for example, by someone else. So I guess that would be an unrealistic expectation to a certain extent where things that are there, but I guess as a protective strategy, as a defense mechanism, it's minimized perhaps. So I guess the timeline to seek help then is prolonged to a certain extent. Yeah.
It's true because when we prolong, that's when it becomes more complex. So sometimes when you start to feel something not right, I think it's good time to consider talk to someone, if someone you can trust. If you couldn't find that, that's when you always can seek a professional help. Like us, like any counselors, psychologists, nearby your place, that will be helping you before going to more difficult moment come in. Because our major concern is daily routine, whatever issue or relationship issue, actually it prolonged. It can go into mental health issue. That's where depression, anxiety will come, and that will be our major concern. Therefore, you may seeking clinical psychologist help like Miss Celeste as well, a psychiatric for medical treatment. So this is what we're hoping to able to reaching out to you to support you before things become bad. Okay, coming to this another aspect, feel that I will have a perfect session. For me, I felt very heavy when just asked these questions. So I'm digesting this heaviness. I hope you answer first. So me, I'll go to you, Celeste.
I guess for me,
I'll
it's
come
a
to you
very
later.
I guess for me it's a very straightforward no. Because I feel like at the end of sessions you should be, I should have said that. And I feel like that's quite a human thing once again, going back to our part one when we were talking about therapists are humans too. Right, so in this case, there's always a hindsight 2020 situation. That's I probably could have said that instead, right? So there will never be a perfect session in that sense, and also there's no criteria for perfect session as well. Like there's no checklist to say like when if this goes right, then you get a tick, and then like 10 ticks equals perfect score. I don't think that can be a measurement in that sense as well.
How about you, Wai?
I like what you said. In hindsight, right, I think we all know we can do better. In hindsight, we all know we can say something else. We can maybe respond differently. But in a way, that also take away the magic of therapy. Because therapy, in some ways, we focus a lot on the here and now. We focus a lot on the experience right now and the connection between us and also the client. So if focus too much, right, on saying the perfect thing, saying the most, I don't know, theory-based, the most theory-accurate kind of directions or interventions, then in a way it take away some of the human connection. So even right now, right, when I was reviewing our podcast video last that we recorded 2 weeks ago, right? When I hear like what others said, right, I reacted the same way that I did in the video. So I just can imagine, just be myself and be human. And being human is not perfect, so no, never will be a perfect session.
Yeah,
So
totally.
two consensus. Sorry, yeah.
Yes,
Two votes for it. There cannot be a perfect session. Would you like to go?
So now me, kind of like the vote. I would say I agree that we do not expect a perfect session, but I will appreciate the other time that we may experience perfect moment in the session. So I do find when you find whatever you share, you understood and you heard, and then it being able to support it, that's like a very perfect moment. I think that is something that we hope to give to you in the therapy session. Yes, I agree that we are not perfect. We are just human beings like you. So that's where we try our very best to provide this called therapeutic encounter, so that help to able to facilitate healing for you. So hope this healing will bring you feeling, able to kind of help you too in the long-term journey, and then you will able to find your perfect you that you prefer, you comfortable with and happy with, and that's what I hope be able to journey that with you. I agree with both of you, no perfect session. I do agree there's perfect moments sometimes. I think that we do encounter that moment's experience as well.
I like that. It's almost like finding perfection in the imperfection.
Okay,
Okay, because that statement is so perfect, I'm going to add this here. This statement is so perfect. I feel like this is the perfect moment. Everything is being shared, like what we wanted to discuss is being addressed very nicely with Dr. Nicole already.
Okay, thank you so much having us here, listening to us. So looking forward to hear from you, what you want to get to know us as a therapist. Do leave, into your comment. Let us know what you're interested. We do our best to be able to respond to you as soon as possible. As well, come out with another podcast to be able to addressing things that you're interested to get to know us in therapy work. Thank you so much, everyone. Thank you.
Thank you.
See you soon.
Bye.
And then it starts like if we film it and then it moves out.
Okay, I'll do the kitchen. Scene 2, take 2.